Hey, everyone. It's Dr. Tamara Beckford with Your Curing Docs. That's right, our health and wellness platform where we're bringing you the top of best of the best, basically, here. But we also want you ladies out there to make sure you take at least 2 hours a month for yourself, right? Putting your health and wellness first. We'll show you how to do that on the platform. But our biggest thing that we love is our Your Caring Docs, Docs Who Cares podcast, right? Where we have doctors from all over the world. They stop by here. They're going to drop knowledge, aka gems. Biggest part is that they'll leave their info so you can get in contact with them if you'd like to be a patient or a client of theirs, right? Today, we are heading into the brain section, and I'll tell you why. We have a very awesome doc here, and I'm going to bring him in Your Curing Docs fashion. So this doctor, he was a graduate of UNC School of Medicine. Then he did his neurosurgery residency at the University of California, Davis Medical Center. Then he did a fellowship at Boston Medical Center. And then he did another fellowship because we only have docs who cares, top of the line, stars who stop by here. That's right. He did a CAST approved. CAST approved means it's the Committee on Advanced Subspecialty Training in Neurosurgery Oncology. We'll tell you what all that is. So he did that on skull-based neurosurgery, and he did it at the Cedars Mount Sinai in Los Angeles. He specializes in brain tumor. Now he is a neurosurgeon at the Tidelands Health in South Carolina. Everyone, help me welcome Dr. Oluwaseun Omofoye. Woo! Yes, the star. That's what we have right here. A star. How are you?
I'm doing well. Thanks for having me. I'm excited.
Not more than me. I'll tell you. I'm super excited. So now we have you here, Dr. Omofoye. All right. So, I dropped a lot of big terms during this intro. I said you're a neurosurgeon and that you did training in neurosurgery oncology and that you also specialize on brain tumors. So some people
Correct.
I know what brain tumors are, but neurosurgery oncology, I don't know what she's talking about. So let's enlighten them. Tell us what a neurosurgeon is and what is neurosurgery?
Yeah, absolutely. I would love to. So, neurosurgery is basically the study of the brain and the spine, particularly surgery for the brain and the spine. So, it's a term that I often get confused with the neurologist or neurosurgeon. Some people don't know the difference between the two. And a neurologist is a doctor who treats any kind of disease in the brain, mostly, and some in the spine as well. But with medications. But if there's any kind of disease that needs surgery, surgical treatment in the brain or in the spine, then a neurosurgeon will treat that. So things like, brain tumors, like you mentioned, but most commonly it's people with issues in the spine is the most common. So if you have like a herniated disc, or, a disc bulge that's causing pressures, causing sciatica, pain shooting down the legs or down the arms from the neck, usually a neurosurgeon can help treat that with surgery. Or if you have stroke causing bleeding in the brain, or if somebody falls, they fracture their skull, or they have any kind of bleeding in the brain as a result of the fall, a neurosurgeon can handle that. And other things like, Parkinson's disease, they can be treated with, surgery if medicine has failed, and tumors in the brain. So there's different subspecialties within neurosurgery as well that I can go into, but that's sort of the broad summary of what a neurosurgeon does.
Wonderful, wonderful. So our neurosurgeon is taking care of the surgical issues in the brain, right?
Yeah, and the spine.
Yeah. And the spine, especially. Right. So like we're saying, those bulging discs that's causing the sciatica, that pain that's running down that leg, you're losing the sensation, you're losing the function of that leg due to that bulging disc. The neurosurgeon is the person for you. And like we said, also patients might have tumors, brain tumors. There are a lot of subspecialty in neurosurgery. And, they're here to help with that and with bleeds, which we're going to talk about. So people hear, about stroke And this,
aneurysms.
and aneurysms, absolutely. So the neurosurgeon is the one that's going to take care of that. So before we get into that, now we know what neurosurgery is and what a neurosurgeon does. But what brought you to that particular specialty?
Yeah, so growing up, I grew up in Nigeria. I was born and raised there, and actually moved to the United States when I was 16 with my family. And growing up, I always knew I was, interested in medicine. There weren't a lot of doctors in Nigeria, and so from the few interactions I had with doctors in Nigeria, it was, a special moment. And I always liked math and sciences, chemistry, biology in school. So that was a good, combination for to be a doctor. Absolutely. And after moving to the United States, did my undergraduate at UNC, and I actually did engineering, even though I knew ultimately I was going to be doing medicine, because I really enjoyed math and physics and the engineering side of things. And my major was biomedical engineering, which is just engineering for medical applications. So designing things that can be used, technology that can be used in medicine. And during my final year of college, we had to do what's called a senior design project, where you work with either a client, a patient, someone who needs some kind of technology assistive device, and you design something over the course of your final semester of college. And we worked with a girl who had a traumatic brain injury. Mm-hmm. So as a young girl who's about 12, she had fallen off a horse when she was really young, maybe about 6 years of age. And she was not able to read like a normal person can. She had difficulty isolating lines while she read. So if she's reading one line, her eyes kind of bounces up and down and goes to a different line. So we had to develop a device to isolate each line while she read, and she wasn't able to control a hand function very well as well. So we had to come up with something that she could use a hand to control that was easy. And so working with her over the course of my senior year, I kind of learned more about traumatic brain injury. And, I always wondered, if more could have been done for her when she had that initial injury, that she wouldn't have those deficits. And that was how I got interested in neurosurgery. And when I started med school, I kind of knew I was going to do something surgery related, since I like working with my hands, building things, coming from an engineering background. And first year of medical school, we had a surgery interest group where all the students just starting medical school interested in surgery get together, and you can have a speaker come talk to you, just like we're doing right now. And we had a neurosurgeon talk to us, and it talked about something called deep brain stimulation. Yeah. And so what that is basically you implant an electrode into the brain, and it can attach electricity to it, and that can manipulate some functions of the brain to improve some function. So patients with Parkinson's disease, that's the most common reason why we do that. And so if you have Parkinson's disease and you have really, really bad tremors, hand is shaking all the time, you can't drink from a cup because your hand is shaking and stuff like that, and you've tried all the medications, you failed the medications, then the next step is surgery. And right. So you talked about that, and I was really fascinated about the talk. And I asked him after the talk, can I come see a case with you in the operating room? So during the winter break of my first year in med school, I saw a case. It was actually an African-American guy who had really, really bad tremors. And interestingly, the surgery is done while the patient is awake. They give you numbing medication around the head, but they keep you awake because they want to do some testing in the surgery. And they make a small incision in the skull and drill a small hole about the size of a dime, and then put this electrode into a specific part of the brain. And they turn it on to test it in the operating room, and they turned it on, and his tremors just completely stopped. Wow! And so for me, it was really remarkable. Sealed it. Yeah, it was like turning, and then they turned it off, and then his tremors came back, and it was literally like turning on and off a light switch. And for me, coming from that background of engineering interest in surgery made sense, and it was really fascinating, and that was kind of how I got hooked into it.
I can imagine, especially when you thought about like the young lady that you were helping, like like a year or so ago, she had these two deficits. One was that she's unable to read the lines because her eyes kept moving, and the other is that her arms kept moving. So to see like, wow, there's actually a way to help someone who's going through this. I cannot imagine that was just mind blown.
Yeah, wow. Yeah, it was like magic.
Absolutely. I can imagine. So, with, not a lot of people during their first year in medical school get to really experience something that's just like, wow, this is exactly what I'm working for. Sometimes they get, because you're not really exposed to neurosurgery that early.
Right.
So
that's true. Yeah.
That's a very that's a blessing for all the patients that you're taking care of right now, and the patients that you've taken care of before, that you got that exposure and had you going towards this goal, because you're taking care and helping so many people.
All right. Thank
you. Now, as we think about what neurosurgery is and your journey that brought you here, one of the aspects that we said neurosurgeons take care of brain bleeds. So not just tumors, but like bleeding in the brain. And a lot of people hear, oh, this person had a bleed. And there are a couple things that can cause this. And we're saying like stroke is one of them. So let's delve into the different causes, especially I guess in some respects, we'll say some of these can be prevented, not all, but some are lifestyle based, causes of the brain bleed, aka the stroke. So
so the different categories that we can sort of break it down into, there are what we can call traumatic hemorrhages in the brain, which are bleeding in the brain that comes from some kind of trauma, like if you fell, or you had a car accident, something hit you on the head, a tree fell on your head, that's a traumatic bleeding. And there's sort of non-traumatic bleeding that's just like a spontaneous bleeding in the brain. So, and then there's the stroke, which there's sort of two branches from stroke as well. You can have what's called ischemic stroke, which is a stroke that you have because the blood that's flowing through the blood vessels in your brain gets clogged up, and the brain doesn't get that blood flow. And that basically causes the brain tissue to die off because it's not getting the oxygen and the blood supply. So that's an ischemic stroke. That's one type of stroke. The other type of stroke is hemorrhagic stroke. And that's a stroke that happens when the blood vessels in the brain basically break apart and the blood spills into the brain itself, and it's bleeding into the brain and a blood clot in the brain, and that's a hemorrhagic stroke. So I guess we can start with that. So the first topic first. The most common thing we see in terms of stroke is the ischemic stroke. And it's about, I think about 80% of all strokes are ischemic strokes. And that's usually as a result of high blood pressure and high cholesterol and smoking. Those are sort of the main risk factors for people to get that ischemic stroke. And what happens with high blood pressure is, if you have hypertension or high blood pressure and you don't control it, over time, your blood vessels get thicker and thicker to be able to withstand that pressure. And then, so it narrows, the pipe that supplies the blood into the brain. And if you have high cholesterol on top of that, then the cholesterol forms plaques, just clogs up your arteries. And then if it can clog up the artery in the brain, and that stops blood flow to the brain. And if you're a smoker, same thing, your blood vessels all over your body have to sort of react to the inflammation, to the effects of that smoking on your blood vessels and become thick, and that can cause a stroke. So if you have a ischemic stroke, usually blood stops flowing in the brain, and that's not a good thing. It's a time-sensitive issue, because if the brain doesn't get blood flow for a minute, 2 minutes, 3 minutes, 5 minutes, that brain tissue starts to die off. And once it dies off, the brain, unfortunately, cannot regenerate. It cannot recover. Only in some children is where you have areas where the brain can sort of compensate for another part of the brain. But the older you are, any adult, pretty much your brain cannot recover function. So once that area of the brain dies off, unfortunately, that's it. Until if someone has a stroke, ischemic stroke or hemorrhagic stroke, the typical symptoms they will have is, things like weakness in the arm. So if the arm goes limp, or you have numbness, you have tingling, or you can't walk, or face starts to droop. Some people they start to slur their words. If we see anybody with any kind of symptoms like that, they should immediately need to go to the emergency room, need to call 911, because nowadays there are actual interventions that can reverse the effect of stroke. And now there are procedures that we can do where you basically can go into those blood vessels and take the clot out. Research is ongoing in those areas, and used to be 8 hours. Now they're actually starting to extend it to 24 hours to do thrombectomies, where you go in and take the clot out, and you can actually see return of some function. So those are good things to know for stroke. If you have the other type of stroke, the hemorrhagic stroke, the bleeding in the brain, then typically that's something that happens due to high blood pressure. So the pressure in the blood vessels is really high. The blood vessels can't really withstand it anymore, and the burst, kind of like having a burst pipe. And the bleeding, gets into the brain. And when that happens as well, it increases the pressure in the brain. It's not a good thing for the brain in that area where that blood vessel is, because that's an important blood vessel that's supplying the brain function. And if it bleeds, that blood is not getting to the tissue. And so when that happens, usually a neurosurgeon sometimes have to get involved to go in and take the clot out. And that's because the brain is within the skull, which, exactly. It's a fixed structure. It's a good thing we have a really thick skull, because that protects, the brain. But at the same time, if anything happens within the brain, like a blood clot, it's a small space, and that pressure just starts to squish the brain. Sometimes we have to go in and drill a hole in the skull to get a clot out, or take part of the bone off, sometimes even. And that even happens for people who have ischemic stroke, where the blood stops flowing in the brain. That sometimes swelling happens, where the brain swells up within 2 to 3 days after that happens, and we actually have to take the skull off, because the brain is so swollen.
It's kind of like it's to relieve the pressure. So if you're thinking of it in plumbing terms, it's like a pop-off valve.
Yeah, pretty much.
The pressure on that skull, so that we can get the brain back and get that function back. Yeah. So that's why it's important to control your blood pressure. Sometimes we can have things called aneurysms develop in the brain. Some people have heard.
And what that means is that if you can imagine a pipe, and if you have high blood pressure flowing through that pipe, sometimes the wall of that pipe starts to weaken. And over time, as it weakens, it kind of balloons out like a balloon off of the side of a blood vessel. And sometimes we see that when there's weakening in the wall, and it sort of balloons out, and that spot is a weak spot that can bleed and cause a hemorrhagic stroke, the bleeding in the brain. And so there are times if we see that on a scan, and that means somebody has an aneurysm. So usually you want to treat it before it ruptures, before it bleeds. And there are different ways of treating it. We can sometimes do surgery to put a small clip around that aneurysm. Sometimes we're going through the groin into the blood vessel and put some coils into that aneurysm to sort of pack it and coil it off. And so that's something that also can be genetic. It can run in families where they just have, a change in their DNA that just causes multiple people to develop aneurysms in the brain. And so it can be genetic as well. But once you have it, then the main thing is, either getting it treated as soon as you can. And if you're smoking, stop smoking and control your blood pressure. Those are two things that you can do to reduce the risk of your aneurysm rupturing. Absolutely. And just briefly touching on the other sort of category of traumatic hemorrhage. So that's mostly common in elderly patients if they fall.
Especially on blood thinners, right?
Yep. A lot of them on aspirin, on Coumadin, warfarin. So if you have a fall, you can have it bleeding anywhere in the brain.
Right.
We can have what's called a epidural bleeding, where it's bleeding on the covering of the brain. But that can grow really fast and cause people to lose consciousness or even die quickly if it's not treated, because it's an artery that typically bleeds. If you have a fracture, you're involved in a car accident, you fell off something, that can happen. Sometimes you can have bleeding under the covering of the brain. That's called a subdural hematoma. That's usually common in elderly patients as well, because your brain actually shrinks the older you get. And so as your brain
has space, it bounces around in
exactly
that
yeah so as a brain, they're actually small blood vessels that attach the brain to the covering of the brain. And as you get older, people who drink a lot of alcohol, their brain also shrinks down over time, and those blood vessels can break and cause bleeding, and sometimes you need surgery for that. And sometimes if you just fall, you have bleeding within the brain itself, like a contusion can happen. So there are multiple different ways that you can get bleeding in the brain. Yeah.
I mean, the brain is so delicate, and as we mentioned, the skull is a fixed structure, which is good. And it's good that it's fixed, and it's good that it's hard because it protects us. Because I mean, we walk around, and if you turn quickly and hit your head in the side of the wall, I mean, you don't want a soft structure. You want something that's really going to protect the brain. But with all of that, it's fixed in its size. The brain is where it is. So if there's any damage to the brain, there's no space for any additional fluid, especially if you are a younger person. Once you get older, brain does shrink. It has some space, but the space is still limited. And that's what we wanted to, So once it goes beyond that limit, the brain is being squished. Once the brain is going squished, you're going to confusion, loss of consciousness. And the ultimate, which we haven't even talked about, is if the brain gets squished too much, it just, what we call herniate, right?
Yeah. So the only space outside of the skull is through the neck, around where the spinal cord is. And so if the pressure gets really high, what ultimately happens is the whole brain just kind of gets squished down into your neck, so to say, and blocks off the flow of spinal fluid which surrounds the brain. And that's what's called brain death. So the patient becomes brain dead when that happens, and they're not able to function, they are not able to breathe on their own, and they can only live through a ventilator. But when that happens, it's the same as a natural death.
Right. And so this is why it's so important that we talked about, we alluded as to why the preventative part of all of this is so important. And even if, we've talked about stroke prevention, trying to keep the blood pressure down,
smoking,
to try to do all of that. But also there's another component that we mentioned that could be partially genetic, which is if you have an aneurysm. So if it is detected, this is not something that it detects and you're just like, if it's detected, you're going to try to talk to your doctor and see if there's anything else that needs to be done. It's not that, they told me about it and then I ignore it. If your doctor says to come to see me, or I'm going to send you to a specialist because I would like for them to evaluate it, then you want to do that. Because as we mentioned, an aneurysm is a ballooning of the vessels. So just like balloons pop, aneurysms pop also. Once they pop,
and that's what's really serious about it, is that if you have an aneurysm in the brain and it bleeds, usually a third of patients actually don't make it to the hospital. So about a third of patients with an aneurysm rupture die before they get to the hospital.
Wow.
The second third usually end up, with some kind of morbidity. They end up with some kind of neurological devastation. Either they can't walk, or they have weakness, or they're not able. Their brain loses some kind of function, which they have to deal with for the rest of their life. and only a third, end up scot-free if you have an aneurysm rupture. So usually, if you have a primary relative, either a parent or a sibling or a child with an aneurysm, then you may want to consider getting checked for an aneurysm. And usually, you get a CAT scan or an MRI with contrast done to see if you have one. And if you do have one, typically, depending on the size, if it's less than 5 millimeters, usually you want to watch it closely. You get scans every year. If it's bigger than 5 millimeters, or depending on the shape and things like that, then you should probably get it treated.
That's so important. I have a family member who had a spontaneous ruptured aneurysm. And as you mentioned, so luckily she is the 1/3 that made it to the hospital, but she's also in that 1/3 that has the morbidity at this point in time. So the loss of function, she's one of the 1/3 that has loss of function. So we're saying all this in that it's just something that happens. You hear about it, and it's important to even know that 1/3 of the people don't even make it to the hospital. So it's such an important factor. And so if you are listening to this podcast and you've been told that you do not ignore if you've had an imaging and incidental finding of this, and you let your physicians know so that they can give you the appropriate guidelines and care for this. Wow. So we've gone into a lot. We've talked about, we've talked about what neurosurgery is. We talked about how you got introduced to this with just even using your mechanical skills and your biomechanical intro into helping a young lady in college, and then seeing how even a neurosurgeon is able to help movement disorders such as Parkinson's with just a neurostimulator right at the beginning of medical school, not even like doing a training. And then, from that moving on into a lot of training in order to help. Now, I know that we've talked about stroke and helping to identify the risk factors of stroke, and also some of the risk factors of aneurysm and why it's important for you to get checked out for both. And if you're having any symptoms, either aneurysm or if you're having symptoms of stroke, there are interventions that are available for those who are having stroke-like symptoms, but we cannot stress it more. Time equals brain tissue.
Yes.
So the faster you go and get evaluated, the better if you start to notice you're losing any loss of function. Alrighty. So I know that you're there. You're taking care of all these patients. And, we haven't even tapped into your big specialty, which is also brain tumors, but it's just so much for just one particular podcast. So we need to know, Dr. Omofoye, how do you take care of yourself with all that you're taking care of with others? How do you take care of yourself and keep yourself rejuvenated?
Yeah, I had to, think about that question and come up with something, because, being a neurosurgeon, you go through a lot of training, and it's one of the really stressful specialties, and it's 7 years of residency.
Let us know how long you've been training because people understand. So you finished med school, and you have how many years after medical school have you trained?
Yeah, so I graduated med school in 2012, so it's been almost 10 years of training, and usually it's 7 years of residency, and that's when you learn to become a neurosurgeon. And after that, I did one fellowship in the middle of residency and one after, and so that's 2 additional years on top of that. So it's been 9 years total since finishing medical school. So it's the longest residency there is, and most of that time you're working, you're on call, you're working some days like 30 hours shifts, and doing that every 2-3 days, and so it's really stressful. I would say sleep was the biggest thing for me after finishing residency. I would say the first night after I was done with my final day of residency was the best sleep of my life. Definitely. So, and since then, I've been I try to get now 7 to 8 hours,
Wonderful.
a night. During residency, I was probably averaging 5 hours, and my last year was pretty bad. Been the chief resident, you're on call 24/7, and so yeah, I would say sleep was a big thing. Listening to
Sleep is
music,
restorative. Absolutely.
yes, definitely. And I had a lot of sleep debt that I had to catch up with, after 7 years.
He's
So
cashing in his sleep debt ticket.
yeah, I know it doesn't quite work like that sometimes.
No, but hey, you tried.
Yeah, well, I'm trying. Yeah, and listening to music, it's a big relaxing thing for me as well. So if I have a stressful day, just kind of go home, put your headphones on, and relax. Exercise, is important too. So I try to get, at least, every day, every other day, do at least 30 minutes of some kind of exercise, push-ups, crunches, stuff like that. Some things to get your, heart rate up. And then, I love movies. I love watching movies. So that's a big thing to just help you distress, think and, or not, think so much, and just, relax and get lost in whatever movie you're watching. And, I'm into art as well. It's an area that I haven't had a lot of time to sort of go back to, but like drawing and painting and things like that.
Creativity and your
Right.
mechanical, your love and your passion towards the mechanical. I can definitely see art being a form
Yeah,
of relaxation.
right. But that's something I like to do more of. I haven't had
Mhm.
a lot of time to do. But yeah, so I'll say
Nice.
those are the things I do for self-care.
Alrighty, so we've talked about self-care. Now let's talk about fun. What do you do for fun?
Yeah, sure. Yeah, I know there's a little bit of overlap in there.
Mhm.
For fun, mainly, I have twin boys that are they're 7, so I like doing things with them really for fun most of the time. So we just moved to the Myrtle Beach area in South Carolina. So we've been doing a lot of stuff at the beach, building sand castles and things like that, and just going to the beach to relax.
Absolutely.
As a big thing. I used to play the drums. Actually, I used to play the drums for my church for a long time. Until medical school when my schedule got really crazy. So, playing the drums and kind of having jam sessions.
Wait a minute, are you having jam sessions with the boys?
They
Because
do
I'm pretty sure
have.
that jam session might sound a little bit different.
Yeah. So for Christmas, I think it was last year, my mom got them a drum set, which I don't think my wife was too excited about that.
Sleep?
Oh, sorry, what was that?
Did you forget to tell your mom you're trying to cash in on your sleep?
Yeah. I didn't think she was thinking about that. She was just like, oh, when you were little, you used to play the drums a lot, and so I'm gonna get the kids a drum set. So yeah, I've been trying to teach him to play the drums as well. So we do that for fun. And I guess lastly, one of the things, since I was young, I've always been into aquariums. I remember when I was like 10 or so, went to a friend's house who had an aquarium, and I was very, fascinated by it. And so I've always had a fish tank, and got one, I think 2 years ago, sort of about the beginning of the pandemic, and got a couple of fishes, and so now I'm trying to get into like aquascaping, kind of building, a natural sort of. It's basically like gardening in a fish tank, essentially. So I don't have a tank now since I just moved from California to South Carolina, and so at some point we'll be starting the tank back up. Yeah,
It's also very relaxing.
it is. Yeah, it is very relaxing.
Absolutely. Wow. I love it. We learned so much about you. It's an incredible journey, and the best part is yet to come. That's what I love about all of this. So now, Doc, let us know, where can we find you? If you have patients who are listening, like, oh, this doc is really cool. He can do so much. And like I said, this is only, I just really hit a drop in the bucket of all that, Dr. Omofoye can
Right.
do. I mean, a drop in the bucket. Like I said, he is also a specialist in brain tumors, but we just really just talked about stroke so that you can understand and really be enlightened about that particular topic. But there's so much, and he's in the South Carolina area. So those who are in South Carolina, like, hey, this is a doc that I want taking care of me. Where can they find you?
Yeah, so I'm a neurosurgeon at Untitled Health in all around the greater Myrtle Beach area. So if you're in Myrtle Beach and Morrow's Inlet, or areas around there, yep, you can find me at Untitled Health. The best way to reach me will probably be LinkedIn. I just started, in last month, so I'm not fully on the website yet, but hopefully soon there should be my contact information on the website for Thailand's Health. But anybody can feel free to reach out to me on LinkedIn through my profile there. If you just search for my name, it should come up. And like you said earlier, my main subspecialty is in brain tumors. So I deal with any patients with any kind of tumors in the brain. Meningiomas, which are benign tumors, to the high grade tumors, glioblastoma, gliomas. Even pituitary tumors, which are tumors at the base of the skull, which we can take out through the nose. And so there a lot of newer technology. We just recently did a procedure where we used a robot to do a brain biopsy. And it was the first time this was done in South Carolina. And so there's a lot of new upcoming things that I'm excited about, and I'm excited to offer patients in this Myrtle Beach, Morrow's Inlet area in South Carolina.
Wonderful, wonderful. I told you guys. I told you, the best of the best. I was not kidding. And now see, I knew, but now you who are listening to this podcast, now also, right? So we're going to thank Dr. Omofoye for stopping by, dropping all this knowledge. And like I said, we only really got to drop in the bucket because Dr. Omofoye is an expert neurosurgeon in brain tumor. He's in the Myrtle Beach area. So contact him. He's with the Tidelands healthcare system. So in South Carolina, if you know anyone who needs his care, his help, he is here for you, and he is an awesome doc, and he's a doc who cares. So you're going to find all of this great information on our Your Caring Docs Who Cares website. You're going to find this great podcast there. You're going to see his profile, and you'll be able to listen to this awesome podcast and get a link to watch this awesome video, right? So I am Dr. Tamara Beckford with Your Caring Docs. That's URCARINGDOCS. We're going to thank you all for listening. Don't forget, you can find us wherever you do listen to your podcast, right? So that's on Apple, Google, Spotify, on Anchor FM. We're sprouting around on Buzzsprout. So wherever you do listen to your podcast, you find this. And make sure that you leave a 5-star review for Dr. Omofoye. I think that he absolutely has earned that. He is a star right there in the South Carolina area. And where to find him if you need help with anything brain tumor related or neurosurgical related, right? So we're going to.
Yeah, and I have to say, this was an awesome, experience. I have to congratulate you as well for this awesome platform. So thanks a lot, Dr. Beckford, for inviting me. And I think this is awesome that you're doing this to, educate the community. This is definitely, well needed. And, kudos to you for taking the time out of your busy schedule, I'm sure, to put this together for the benefit of the community. So congratulations and thank you.
It's my pleasure. Thank you guys. Thank you guys for all, accepting the invitation to come on and to share your skills with others. I really appreciate you guys. And don't forget, jump on the podcast, leave a 5-star review. Dr. Omofoye is the real deal, guys. All right. Take care, and thank you guys for watching and listening. Bye-bye.
Thank you.